Brett, you're muted.
How about now? Better? Great. Welcome everyone to July's Management Forum and welcome to the middle of summer. And I hope that you've all either had or will soon have the opportunity to take some time with yourself and loved ones, doing something that restores you, some recreation, some fun. I hope you're enjoying the weather. Um, there are places in the country that would kill for our 50 degrees and foggy. Um, and I hope you're enjoying that, or I hope you're enjoying the warm weather where you are. So we have a very full agenda today, and I'd like to start by introducing Luena Kim. Luena is going to be discussing new guidelines about vaccination of staff and about self-reporting of that. So Luena, take it away.
Great. Thank you so much, Brent, and for everyone. It's really nice to be before Management Forum. When I was at DPH years ago, I really enjoyed and have fond memories of Management Forum. And when I went over to HSA, I tried to have something similar to that. Was unsuccessful until the pandemic to get folks together. So thank you so much for inviting me to this. I know that there has been a lot of conversation and talk around the self-reporting part of the vaccination as well as the mandatory vaccination. So I just wanted to take a few moments to go over it with you, and then I'm happy to answer questions. I know that all employees received a copy of the new vaccine, the face covering policy, as well as the vaccine policy. So I won't go over that since you all have that copy. There was a new vaccine and face covering policy FAQ that was issued by DHR yesterday. So please look for that because it has some really great information, FAQs about the policy and the protocol. And just to state that the face covering policy and the vaccine policy are issued by the city for city employees, and they mirror or are a result of Cal OSHA for all employers. So I know that we have many different employers on campus. What I'm going to talk to you today is relevant to and for city employees. But there is a lot of overlap since it is Cal OSHA, which represents all employees from the state of California. In addition, and an overlap of that is the health order that was issued about the vaccine and the face covering, and there was a change that was issued recently regarding when the mandatory vaccine will go into effect. So I'll go through some of that. So there is as I mentioned, there's a face covering policy and the mask policy. I'm going to go through sort of the reporting, since that is what is the most sort of in front of us now. So just so everyone knows, in the city, the requirement is to report vaccination status through the employee portal by July 29th. So we have about half of our staff at DPH have so far uploaded the documentation. So we only have half to go. So I just encourage you all, if you haven't done it yet, please upload the documentation regarding your vac status. And that is through the employee portal. If you don't have the link to that, it is on the information that's been sent out by DHR. We can of course send it out again on how to do it. So on the portal, there is a section under the employee side where you can upload the documentation. There are instructions and videos, as I understand it. Please make sure to follow the instructions really carefully. The order in which you do things, well, it's not overly intuitive. If you follow the instructions in sort of step by step, you should be able to do it. There is as I've understood it, there is some glitch or difficulty there was in uploading the attachment. So please make sure that the attachment uploads, and you do that by going back and hitting submit. I do have a list of I do have a list of people who have had where the attachment has not gone through, so I will start sending out that information. As stated in here, while the VAX documentation is not protected by HIPAA, we understand the sensitive nature of it, and please know that only limited people within HR have access to the document, the information that individuals are uploading. And so there are several reports that are available. One is just the yes or no to the mask. It's either required to mask or okay to unmask. And it just has the name, work location, and roster code supervisor, and just that simple information. That is what is going to be distributed out to supervisors about required to mask or unmask. There is no information contained on that report regarding any vaccination information or detail. It's a completely separate report, just to let people know what is being sent out. That will be sent out to the HR team every Monday. The most updated information, I send it out to HR team. And then on or about Tuesday is when that information starts getting distributed to designated individuals in the department. That is just the required to mask or unmask. That is what's uploaded into the, that is what is being sent out. That's the sort of basic around the requirement to upload the documents by July 29. So please make sure that you and your staff upload that information. As it relates to the mandated requirement about vaccination, as I understand it, the health order was issued recently, which makes for those who are working in high risk settings to be fully vaccinated by September 15. I know there will be a lot of questions. The city is in a meet and confer process with the unions regarding how this is going to roll out. So there's a lot more to come. Just so folks know, there are per the ADA EEO, there are exemptions for sincerely held religious belief or medical exemptions. So please look for more information regarding that. So that's a basic update on the VAX. If there's any questions, I'm happy to answer them. I know you have a full agenda, and so I want to respect that time as well.
Thank you, Luana. Let me ask a couple of questions that have come in from our attendees. What will happen to employees if they're not able, for one reason or another, to upload their information by the July 29th date?
Thank you for that. Please make the attempt, and if you're not able to, contact HR, who can help, somebody in HR. So there is information about, so go to your local contact in HR, and who can help you upload the information. If people don't have access to a computer, there is a way to fill out a paper form and somebody can upload that information as well.
Okay, that would be great to share that process. Because I do know that we have employees who don't have regular access to computers at work. Do all employees of ZSFG have to be vaccinated, or just those who provide patient care?
The mandatory vaccine requirement applies to all city and county of San Francisco employees. That is the policy of the city.
Okay, thank you.
But that is sort of more information to come. That is down the line. Right now, we are at the documentation phase. That's due July 29th.
Right. Okay. Thank you. And then another question we got is with regard to the deadline. It seems the deadline for employees at ZSFG is shorter than the deadline for other city employees. Can you talk about why that is?
You mean the deadline for the vaccination or the deadline for the documentation?
Documentation.
I do not, the deadline for uploading the documentation is July 29. I've not heard that there is an expedite or a shortened deadline for DPH.
Okay, so all city employees have the same documentation timeline.
Yes.
Okay, super.
If anybody has any documentation that says otherwise, please send it on to me, but I have not seen anything that has accelerated the timeline for any particular group.
Okay. And then another question, Luana, is there are employees who are going to get exemptions who are not going to be vaccinated. Um, do they still are they still required to register their status in the, going through the portal process that you mentioned?
Yes, so thank you for asking that clarification. There are two different requirements that we're talking about. One is documentation. Everyone, all city and county San Francisco employees need to upload their vax status or their documentation into the People and Pay portal, SF employee portal. That is one process due July 29th. And
Okay.
then the second one is the vaccination, which has exemptions that are permitted. The exemption for sincerely held religious belief and a medical exemption does not apply to the documentation portion. It applies to the vaccination portion. I
Okay.
hope that's clear.
Yeah, that's very clear. Thank you so much. Okay. We also have a question which I think I'm going to defer to Lisa because it's involving masking requirements. Luana, can you stay on the line for a while, and we'll see if other questions come in that involve the self-reporting?
Brent, can I ask a question of Luana?
Yeah, of course.
This is something that I know is tricky. It's actually a two-part question. So the first thing is, Luana, can you talk a little bit about the responsibility of supervisors and managers versus HR in terms of, making sure that employees are getting information into the portal? That's one thing. And then can you talk a little bit about this, what kinds of questions management can ask of employees? And what I'm really getting at is there's a subtle difference between asking somebody if they're vaccinated versus asking if they're eligible to unmask. And I think that's really important for people to understand. So could you comment on those two questions, please?
Sure. As I heard it, your question, the first part of the question is, in terms of assisting employees in uploading their information into the People and Pay system. So I would, because it contains information around the vaccine and the status of the vaccine and some level of medical information, I would really, I think the preferred approach is to encourage employees to contact HR if they're having difficulty uploading the information instead of helping employees upload, having a supervisor view that information to upload it for their employees. I do appreciate supervisors trying to be helpful, but I think given the nature of this information, I would encourage them to contact, give them time to contact HR and seek assistance in uploading their documentation into the system. And I know, and as to the second part of your question, I know that it's a fine line, but I think it's an important distinction. The difference between asking an employee, a supervisor asking an employee, are you authorized to unmask or mask, is the question to ask versus what is your vax status? Because while we may connect fully vaccinated to mask or unmask, there may be, as we go, there may be many reasons why somebody will be required to mask, be it in a setting or be it they have an exemption or for whatever reason, and you can go into a level of detail that an employee may not be comfortable with and start getting information that becomes confidential. So I think that for supervisors, the appropriate question is, are you authorized to mask or unmask, and leave it at that. The other part is, we know that in our healthcare setting and others, especially given the Delta variant, people may want to mask anyways. And so I'll leave it to Lisa to answer this more, but I don't think we want to necessarily encourage people to unmask if they want to mask or especially in the setting that we're at. I hope those answered both your questions.
Yeah, that was great. Thank you very much.
Thank you so much, Luana. Lisa, everyone's talking about you. Maybe we could get kind of where we are with respect to COVID, also where we are with respect to campus safety, guidelines, whatever you can share about, masking, about meeting in groups and all that. You have so much to talk about, I know.
Thank you. Thanks, Brent, Susan, and Luana. So I'm going to keep our discussion about COVID local today, because I think that we are really in a transition period, and there is, as has been mentioned, a lot of confusion. And I think where the challenges are, we're at an intersection where, we're very fortunate that San Francisco has done extremely well in terms of getting the public vaccinated. And we have a high number of our staff vaccinated, and we expect that more people will be getting vaccinated in the coming months due to the requirements, although there will be some people who have exemptions. The other information that we have is that our vaccines are really, really good, and that has been extremely encouraging. So most of the infections that we're seeing are in people who are unvaccinated, and particularly those that are resulting in people getting sick enough to be hospitalized are almost all of them are in people who have not yet been vaccinated. Although there are rare exceptions to that. I think that the challenge that we're seeing, though, as everyone knows, the Delta variant that was first described in India, but is really the worldwide variant at this point, it appears to be the most common strain of the virus in the US at this point, and the Bay Area is no exception. It's estimated that more than 50% of our cases are the Delta variant, and this number is rising. And the real challenge with the Delta variant is that it's more infectious than the other strains we've seen. Both more infectious than the original strain of the virus, but also more infectious than some of the other variants. And we have seen some breakthrough infections in people in the Bay Area and in our staff who have been fully vaccinated. Although again, the risk is much, much higher for those who have not been vaccinated. So we are trying to, as we are returning safer together, we are trying to balance all of those factors and the changing epidemiology in San Francisco, where we are seeing a bit of a rise in the number of cases. And there's a certain amount of uncertainty about exactly how much transmission there will be and how high that rise is going to get. So let me just tell you the things that we know are going to happen or continue to occur, and then we will talk about hopefully the areas that we would like to clarify over the coming week or so. So the first thing that I just want to say is that we are still masking for any instances where we are providing care to patients and when we are in public areas. So the state guidance and the CDC guidance is very clear about that. So whenever we are providing patient care, we are wearing masks. Our patients, visitors, and research subjects, when they come into the hospital and into our clinics, are wearing masks, and we do not anticipate any changes in that for the foreseeable future. The other thing, as Luana mentioned, as we are working out what other areas people may be eligible to unmask, it is always permissible to wear a mask. So people may have personal concerns about their own health for whatever reason. They may just feel more comfortable, based on the number of people. They may, wish to continue wearing a mask, even in areas where it may be permissible to unmask, and that is absolutely and completely fine. And we just want to, be really clear about that. So those are the areas that are clear. I think the areas that we are still working on providing clarification are exactly when it is going to be permissible for people who are fully vaccinated, and if they are city employees, they've uploaded their information, so they're qualified to unmask, where they're going to be eligible to unmask when they are on our campus. And the reason we have some differences here compared to the information that's come out from DHR is that we are a healthcare setting. And so we are being very cautious because we have, patients and visitors here that we want to keep safe, as well as our staff. And then we also work very closely with other partners like UCSF. And UCSF has issued unmasking guidance as well. And it's always very helpful when we can align with that. I will just say that we've been working very hard on some unmasking proposals, but we have just gotten some additional information this morning that some of our partners may be considering some changes. So we are going to continue to discuss that at our meetings here, because when we do issue the guidance, we just want to make sure that it's something that we can continue for a little bit of time. We don't want to issue a clarification and then have to change things a few days later if we can avoid it. So we're sorry. We know people are really waiting for, clarity, and we're trying to provide that, but we would like whatever we put out there to be able to be stable, at least for some period of time.
Oh, okay. So a couple of questions, and let me start with this one. And it might be to you, Lisa, and it might be to Luana, it might be to both of you. And that is, Luana, you mentioned sincerely held religious belief and medical conditions as justifications or possible rationale for not being vaccinated. Could you kind of unpack that a little bit and explain a little bit about what those reasons might be? Just give a little more detail, perhaps.
Yeah, it'll be really brief because I don't have a lot of detail at this point. I know there's a lot of questions about it, and so the medical exemption and the sincerely held belief is not a new. It's not newly created for the vaccine. It exists, be it for other vaccines like the flu and others, or things. So, but I know that we want to make sure that we are consistent and people understand what it means to have a sincerely held religious belief or a medical exemption. I know that there are a lot of concerns regarding equity and the way in which exemptions will be determined. So we are having conversations within the city's HR community to be able to provide very clear guidelines to our staff about that. So I know that there's a lot of questions and more to come on that.
Okay.
Yeah.
Okay, thank you so much. So we'll be expecting something likely from like a citywide guidance from DHR on those issues.
Absolutely, because
Okay.
this should be a citywide determined consistent approach to this. So we want to make sure that we are consistent with the city,
Right.
Especially given all the concerns that people have about this.
Okay, thank you. Lisa, There's there's some questions about masking, right? And first of all, patients continue to be masked. Is that correct?
That is correct. So patients, so our youngest pediatric patients, of course, are not wearing masks. But otherwise, the expectation is that our patients will be masked. Of course, as everybody knows, there are some exceptions. Patients are not always perfect about keeping their masks on, but we are when patients come into the building, they're given masks. We should be encouraging them to keep their masks on. And that also goes for inpatients. Whenever anyone else, any healthcare worker, any staff are entering the patient's room, the patient should be wearing a mask.
Okay. And the kind of masking or the areas that are going to require masks going forward. How do you anticipate that kind of guidance looking? Is it going to be by building? Is it going to be by area? Kind of how are you thinking about that right now? I know this is ongoing, but
Yes. So as you know very well, Brett, we're discussing this right now. But the way we are envisioning it, because our buildings are multi-use, is that we would make a distinction in the building that if an area is accessible to patients, visitors, research subjects, so any members of the public, then those are areas in which staff will be wearing masks, and the patients, visitors, research subjects, any members of the public will be wearing masks. So that includes lobbies, elevators, hallways, all of those areas, if they are accessible to non-staff. That's what we are envisioning. The part we are continuing to work on is under what circumstances in the areas that are not accessible to patients, visitors, and research subjects, what are the circumstances where people can safely unmask. So that's how we are envisioning the division. So probably not by building.
okay. Thank you so much. And I think we can say that, discussions are ongoing. We will communicate with everyone on staff as soon as we're able and with as much information as we can share about masking guidelines and really all guidelines moving forward. Are we just kind of a last question for you, Lisa, for the moment? Are we at what level of concern about the bump we have in cases right now?
Yeah, well, the numbers that we have are certainly much lower at this point than when we surged at the end of December and into January. That surge was much higher than what we are seeing now. So we are seeing a small increase. But the concern is really about how much higher it will go. The other thing that we're seeing that is very different from what we saw before, we're seeing, as I said, mostly it's folks who are unvaccinated, although not exclusively. And because we have had so much success in getting our older residents and patients vaccinated, we're seeing younger groups, and so in some cases we're seeing people who are not as quite at high risk in terms of their outcomes. So so we, you know, that we may not, we expect that there will be some rise in the, whenever we see a rise in community infections, we see a rise in the hospital, but those may not rise exactly in parallel, depending on the level of risk and level of medical risk of the people who are getting infected.
Thank you. Terry, you've been so patient. I know that you have so much to share. There's so many projects going on. What do you have to say today, Terry?
Good morning, everybody. I have a presentation I am putting on the screen. Hopefully you can see it. I see the thumbs up for Brent, so I will move forward with my July monthly construction update. I don't know if you noticed, but we took the floor up or the carpet up in the cafeteria. I guess we could call it Cafe Rustico because we're going with a concrete floor for now. We do have a vision to do a full transformation of the dining room over the next few years. We took the opportunity to pull the carpet up and just expose the concrete and not go to the expense of putting a whole flooring product down that's probably going to be replaced once the project goes through a design phase. So we thought we'd play around with the concrete, and surprisingly, it came out looking kind of fun. It was a process where we ground it down, filled it in, and then buffed it or ground it down again and smoothed it and put a sealer over it. We did the south side, and then we moved everybody over to the south side, and then we're working on the north side right now. So that should be done by the end of the month, and we'll have the whole dining room open. There will be some work happening on the east side where we're going to create a temporary servery to support, to move the servery out from its current location while we do demolition for the dialysis project, which is above the cafeteria there. So there'll be some more movements going on in there, but for now we're going to have a concrete floor, and I hope that it doesn't have all the issues that the carpet had with you know, heavy use and maintenance concerns. That's the building 5 second floor cafeteria. We have been working on the rehab project. As you know, we're very excited about relocating the rehabilitation services from the basement to the 3rd floor. However, we did run into some snafus with final acceptance from Oshpod, so we are working through that. We did the mechanical balance. We're doing fire alarm testing, pre-testing right now. Oshpod added an extra hurdle for us at the end of this project, which we are now trying to work out how to become compliant. Once we have that figured out, we'll be executing, and hopefully sooner rather than later, we'll be moving into our transition phase, which is the facility fit up, training and orientation and licensing. An associated project that can't start, actually there's 2 associated projects that are being held up until this gets occupancy, and that's one, the dialysis relocation, which is going to be right adjacent to the space, and there's a shelf space which we've done some early work, but we really need to get this project rehab done to move on to the dialysis project, which is going through a bid process right now. We have several bids complete, but we're still working through the city process on the bids for the dialysis project. So we're looking forward to not only moving rehab from the basement up to the 3rd floor, but also starting in earnest on the dialysis project, which I mentioned is going to have a small impact to the cafeteria down below, which we will be working around. The other project that's tied to this is the public health lab. As soon as rehab is relocated, then we will begin the public health lab in earnest. 6th floor construction is also tied to rehab as far as the permit's concerned, and it's pretty much complete. We're just trying to do this fire alarm improvements that they're asking us to do to allow for full occupancy to the space. So 6H will be an open office space plan. and it'll be used for surge space as we go around the building and do seismic work. We're hungry for surge space because everybody, as I've mentioned before with the seismic project, you know, who's impacted? Everybody's impacted. So we will be using this to as temporary office space for people that are impacted by the seismic work. Security projects, we have a building 2 security project, which is just about to get underway. This is going to create a secure foyer, elevator lobby area, and then secure the back of the house area. The mezzanine project, I'm sure you guys love the orange barricades up on the mezzanine, but I'm working towards getting them away, and we're going to have a glass face there. We had several setbacks on this project, which is why it's been lingering there. But we're at the tail end. We just have to assign an inspector to the project, and we'll be rocking and rolling on the 2nd floor there. Campus access restrictions. We're trying to do. We're still continuing restrictions to the buildings. You know, the main points is Building 5 South Lobby, Building 25, and 8090. Those are the main public entrances to the building. It's the main entrances for everybody. We're looking at ways to improve that. We're kind of doing PDSAs. So if you see things changing in the lobbies, it's because we're trying to improve on what we got out there and see what we can make permanent. The seismic retrofit I talked about. It's got kind of a soft start going on in the 1C area right now. We are still going through some of the bid packages that are associated with the retrofits. So once that's complete, we'll begin even in the pharmacy. Will be probably one of the big areas we'll be working, and it'll be impacting that corridor outside of the pharmacy. And as we get closer to actual start dates, you'll be hearing more from the team and from me as well. The last thing that I'm going to end up on is my pitch for the San Bruno parking lot. If you're in need of parking, we have a satellite parking lot at San Bruno in 16th with morning and afternoon shuttles. But if you want to get healthy, it's just a 1 mile hike from that location to the campus. And the parking permits remain at a very affordable $104 monthly permit fee. With that, I see that Ken Humphreys is on the line, and I'm going to pass the baton to him to talk about the UCSF research building construction project. I will pass over I will stop sharing.
No, go ahead and keep sharing. I don't have anything to share as far as the screen. So if you can leave that up, that'd be great.
Okay, I will put it back up.
So welcome everyone. Right now, as we're speaking, the last deck pour is happening up on the roof level. So some of the noise work with the concrete and the exposed metal decks is going to be stopping. The only thing we're going to have the building for concrete or equipment pads on the roof, on the 1st floor and associated areas such as that. Until we're actually also going to pour on the north side, adjacent to the roadway, the flat work for the sidewalks. So we get that work out of the way. So while Terry and his group are doing other things there on the roadway area, we'll be getting out of the way, trying to be good neighbors. Within the building, we've got fireproofing, spray-on fireproofing. You'll see tarps hanging off the side of the building so we don't spray outside of the building, but they're on the 2nd floor working up through the building. And the exciting part is we're framing walls on the inside and outside of the building right now. Things are really going hot and heavy, along with the mechanical, electrical, and plumbing work overhead, and soon in wall work. So the crews are going to start getting bigger and bigger on the site. To date, we've been 30 to 50 people, and it's going to start becoming more like 100 to 150 people. That being said, the project team that's been out there have worked really safely on the site. Like we've had 4 first aids, one being dust in the eye, a little nicked finger, a turned ankle, things like that. Nothing where anybody has had to miss work. So we're going to have another safety lunch for the crew in early August, I believe on the 5th. And most of the work over the coming months is going to be within the building. Right there on the side of the roadway, we'll be framing that wall and putting all the protection over it, such as drywall and whatnot. So we'll be blocking things off. It's going to get a little bit quieter within the building. And then coming up in late August into September sometime, we'll be putting the skin on the north side, which will be the real noise block to protect the hospital from the ongoing noise of the building, which we try to limit, but you know, it is a building, so we do the best we can. We are going up, I believe Jerry got together and was supposed to go up yesterday to look at installing some sound protection on level 3 of building 5. This has taken a little bit of time to come up with a good fix, and I apologize for that. But we're going to put some protection in over the windows to mitigate the noise until we do have the exterior panels up on the building. Other than that, unless there's questions, that's all I have, Terry.
Ken, I have a question on the west side of the building, actually the corner of the building. You got red boxes hanging down. Can you explain what those red boxes are for?
Yeah, it looks very strange right now because you have big threaded rods hanging from the deck above, and that is like a suspended stairwell that's going into place. The exterior of the building is going to be open, and you'll be able to see the stairs. So it's a nice visual as you're walking by. You get to see people migrating up and down the stairs. So it's an architectural feature. So there'll be quote unquote floating stairs.
Great. Well, thank you both for bringing us up to date on all the construction on campus. And I think Susan, I've got a couple of questions to ask you. This might be a great time. Do you have something you want to say before we get into questions?
Thank you, Brent. Yes, I want to make sure that everybody's questions get answered. And I also want to just express my gratitude to everybody. I know this is summertime, and I really want to reinforce what Brent was saying about people taking time off. I know that they are. And I know this is also a time when things are changing quite a bit. I mean, we've basically been through a year and a half with a lot of change, a lot of unknowns. And we've done an exceptional job here, I think, of managing that very uncertain territory. And we're continuing to be in an uncertain place. And I think that's a lot of where the questions are coming from. And so I just want to say, you know, we'll do our best job answering the questions to the extent of our ability. And we'll let you know where we still have areas of uncertainty. So I want to clarify something about vaccinations. There was a health order issued that does address the timeline for people who are working in high-risk settings, including the hospital, to be vaccinated sooner than others. So even though the documentation deadline is the same for everybody, people who work in the hospital, people who work in the jail, skilled nursing facilities, residential care facilities for the elderly, and homeless shelters, we are required to be vaccinated by September 15th. So this did move up the deadline. It did take away the condition based on full FDA approval. And the reason that this is happening is because of the concern about the Delta variant. That in these high-risk settings, it's more quickly important for all of us to be vaccinated. So for those of us who work in the hospital, we do we're required to be vaccinated by September 15th. There is still the exceptions, the medical exceptions and the deeply held religious belief exceptions that apply. So for people who have those exceptions, they register them into the database, but the requirement for vaccination is moved up. So I hope that clarifies that question about why it is that people who work in the hospital need to be vaccinated sooner. We all need to get our information in, but the vaccination deadline is sooner than others for others. So that's one question. I see a question about entrances, and so I want to address that. One of the things that we found, one of the striking things we found during the pandemic was that with the real restriction on entrances into the hospital, the safety of our environment improved dramatically. And so this is one of the areas where we're trying to take those lessons and apply them going forward. And what we want to do is balance people's ability to enter the hospital conveniently with the need and requirement to ensure a safe environment. And even before the pandemic, it was really clear to our security director, Basil Price, that our hospital was far too porous, and our practices with controlling entry were not consistent with other hospitals. So we have been entering only through building 25. We've relaxed that now, and we can enter through building 5 and 25. We're considering how much more to expand entry, and we're in the process of sorting that out right now. So again, this is one of those areas where we're in process and we're trying to balance safety and security with people conveniently entering the building. So I would stay tuned on that one. Terry, do you want to add anything to that?
The only thing that I'd add is that separate from the controlled accesses into the buildings, I am working with UCSF and Bolt to reopen the stairwell that goes to Vermont so that there'll be easier access from Vermont down the south side of Building 5 to the main entrances of 5 and 25.
Great. Okay.
And that'll just be for staff, right, Terry? That entrance.
That's the public. No, that's outside the building, and it's a stairwell from Vermont Street that's along the new ramp. And right now that's the south side of Building 5 is kind of a dead end. And once we open it up, that stairwell will be a through flow all the way to Vermont.
Okay.
So there's another question that I'm not sure I fully understand, but it looks like it's getting at, with the new strain of COVID, and let me just be clear, and I want to reinforce what Lisa said. The strain that we're worried about is the Delta variant. That is the predominant strain now, and it's likely to grow. So really what we're talking about when we're talking about variants of concern, it's the Delta variant. And that's going to be true for some time now. What we know about the Delta variant is that our vaccines are very good protection against that variant. There are some rare exceptions, as Lisa mentioned, and I think this is what has people concerned. But in general, the vaccine, being fully vaccinated, protects us against the Delta variant. That's why we have an accelerated timeline to be vaccinated. That's why we're pushing, as much as possible to help people get their questions answered about vaccines so that everyone in the community can be fully vaccinated. But then the question arises, well, if we're so concerned about the Delta variant, then why are we letting people unmask? Well, people want to live their lives also. So we have to balance our concern about that variant and what we know about the effectiveness of the vaccine and the transmissibility of the variant with allowing people to sit down in a room and eat together, for example. We know our staff love to eat together, and now you can eat together outside but we can't eat together inside. And so we're trying to really understand under what circumstances can people be unmasked safely. So this is the balance we're trying to strike. And I don't know, Lisa, if you want to say any more about that, but you know, we haven't changed our masking guidelines yet, but we are looking at circumstances where we might, in order to give people the freedoms to do things that they really want to do together.
Yeah. Thank you, Susan. That is well said, and it truly is a balance. And as I think everybody, you know, in this forum knows, you know, we all are looking at the data. We're looking at our public health guidance. We're looking at what's happening on campus, and you know, we will, with input from everyone, we'll make the very best decisions that we can, and then we will continue to evaluate. And if we need to, we will update and change course. So we really want to be guided by the best data, the best science, and then adapt to the circumstances. But even though we're flexible and we are prepared to change, we don't want to make people change every few days. So we're trying to come up with some clear guidance that we feel like can be stable, at least for a period of time.
So I think I answered people's questions that were submitted in the Q&A section, but Brent, please check me if I haven't done so.
So I do have a question. I think this would go to Luana, and that is if an employee opts for either religious or medical exemption to vaccination, how long does that exemption last? Is there a requirement to, I don't know, recertify every so often?
Thank you for clarifying that question. I didn't understand it. I don't know whether there's going to be an annual recertification of the exemption. I'm not sure, but I will look into that. I also see some questions about non-city employees and whether about how to upload their information into the San Francisco employee portal. As I said before, this is a Cal OSHA requirement that every employer needs to roll out for their employee to monitor and review. So please, if you are not a city and county San Francisco employee, please check with your own HR department to find out how they are going to be complying with the Cal OSHA requirement. Even though the city policy may not apply to non-city employees, there is a statewide requirement that may apply to you. So please contact your employer about how to comply. There were questions regarding what if employees are not able to upload by July 29, will they be disciplined? I know there's a lot of questions and concerns regarding what are the ramifications of not doing the documentation on time and or the vaccination. And I know there's a lot of concern around this. As Susan and Lisa has said, it's the issue and the concern really is around the public health nature of this. In HR, and we're committed to helping people be able to comply through the documentation. I know that it's not, there are some steps that have to go through, and it may or may not be the easiest process to follow. There are instructions, but if anybody's having any difficulty in being able to upload the documentation, please contact HR, please contact me, because we want to help you be able to provide this. I don't know that the 29th is the hard and fast, but we really do want everybody to upload or make an attempt to upload their information by the 29th. And again, please try not to wait till the last minute, but just try and do it, and we will do whatever we can to help you. As for the vaccine itself, I know that there's a lot of concern by some individuals or others, be it equity or for personal reasons, be it medical, religious, or other reasons. We know this is really sensitive, and we want to be mindful of that. I know the unions have raised issues and concerns about this, and we are in a meet confer process. The city is, DPH is not, because this is a city, again, this is a city process. And so the city is involved in a meet confer. So if you have any, please feel free to share your concerns with the union as they go through the meet and confer process. So I just wanted to, I know there were a few questions about that. I wanted to acknowledge that those questions were there. And to let you know that we are here to try and help everyone be able to comply with the requirements. So yeah, thank you for letting me talk a little bit about that.
And while we have you warmed up, Luana, what happens to employees who haven't been able or haven't been vaccinated by the 15th of September?
Again, the requirements are that people need to be vaccinated or have one of the exemptions, but sort of what is the results? I don't have that level of detail at this point. I know that there's a lot of concern about it. So I will continue to raise that issue, and I encourage employees to raise their issue with the union as we go through the meet and confer process. That's the information that I have at this point. If I have anything in more detail or concrete, I will definitely share it. But that's the information that I have at this point.
And just to add in from the health order, from the perspective of the health order, what the health order says is people who choose not to be vaccinated for one reason or another after the September 15th date, they will be required to wear a well-fitting N95 mask and be tested weekly after September 15th. We haven't really gone into that at all because this is early on, and we're really focused on ensuring that people have the information they need to make a vaccination decision and to get their data uploaded into the system. We will address the the testing, the masking, the enforcement, when we get to that point, but we're not quite there yet.
So I think we have exhausted our questions and exhausted our time. Susan, do you have anything to close?
Yes, I would just like to thank everybody for being present. We have a really good attendance at these. People are asking really good questions. I want to really appreciate people's patience in helping us navigate this time of change and uncertainty. The main principle here is, we want to, as much as possible, follow science, data, and facts in our decision making. We want to be transparent as possible. We want to answer your questions. So please feel free to reach out to me or Brent or anyone about your questions if they haven't been fully answered. We're doing our best during this time of uncertainty, and we'll keep you informed as much as possible. So thank you everybody for being here, and we'll see you out there. Take care.